Being diagnosed with COVID-19, getting kids back into the classroom is a bit of a moving target.
But as medical reporter Liz Bonus explains now, infection protection specialists say that parents should consider the benefits as well as the risk.
Hey guys, hello to you. The path forward when it comes to in-person learning continues to change. This week, the American Academy of Pediatrics and the Children's Hospital Association announced in the last 2 weeks of July, almost 100,000 kids were diagnosed with COVID-19. That is a 40% jump in cases. But it's important to consider why we might be seeing these kinds of numbers. At this summer in-person learning program at the YMCA, the kids here have been wearing masks and taking all necessary steps to safely be inside all summer for group instruction.
In fact, there was a major review that just took place of the 40,000 kids in pandemic child care centers. We did not have a single outbreak because we're doing things like this.
But as testing numbers rise in kids, it's important to assess why we may be seeing an increase in childhood coronavirus cases right now.
Part of it is that more kids are becoming symptomatic, I think, as there's more community travel and people are out doing things in groups again. Part of it is that some kids may have been tested because they were exposed to known cases from parents or some other source. And I think some kids have been tested because we're starting sports programs. And so some sports teams decided they were going to test everybody, even if they didn't have symptoms, to remove those kids who might be shedding virus before they started practices.
So infectious disease specialist Dr. Stephen Blatt told me parents should consider what's being done where kids would go back to in-person learning. If they can space out, if they can wear masks, and can have isolated groups if someone does test positive, there are considerations that go beyond academics.
Schools have a lot more purpose than just education. There's socialization. Some kids depend on school for food. So there are a lot of reasons why getting schools open is a good thing.
Now, clearly, as the information changes, being able to adapt classroom learning programs may be important. And keep in mind that we do that now in schools in a number of ways. When there's a bad virus or a flu outbreak, even before COVID-19, schools would often close for cleaning for a couple of days. When there's bad weather, home learning programs are often implemented. This may be the year where those adaptations are the secret to the path forward. I'm medical reporter Liz Bonus. Now back to you.
Thank you so much, Liz.